Hello and welcome to PT and Nutrition Education's e-learning platform. Today we're going to start preparation for your Level 2 examination for Anatomy and Physiology in Personal Training. As you can see from the screen, today's topic is going to be related to the skeletal system. It is, however, also worth mentioning that when it comes to your Level 3 examination for Anatomy and Physiology, there will be certainly things that are repeated from your Level 2 criteria. So it may be worth going over this video, the lecture notes, and also some of the activities which are part of this lecture series in order to prepare for your Level 3 exam as well. So as I've just mentioned there, we're going to try and make this as interactive as possible. So rather than this being just a lecture, there are also interactive activities which we would like you guys to complete as we progress through the lecture slides. You can find these resources on our website or on our Microsoft Teams hosting page. You can speak to your tutor about how you can specifically find these. So before we do start, please make sure that you've got the learning booklet at the ready, whether that's in a paper version or whether that's online. It's completely up to you, so that you can take part in the upcoming interactive tasks as we progress through the lecture. So here are our objectives for today in relation to the skeletal system. By the end of this lecture, hopefully you should be able to identify all of the major bones within the skeletal system and some of the functions related to the skeleton itself. You should be able to illustrate the vertebral column and also identify how many individual vertebrae are in each section of the vertebral column. You should identify and distinguish between the axial and appendicular skeleton. You should be able to specify the different types of bones, and you should also be able to identify the different types of joints and also the movements that are associated with each. Now, as I've already mentioned, this does cover Level 2 and Level 3 criteria, so it is worth re-watching this lecture when it comes to prepare for your Level 3 examination. The first objective relates to naming all of the bones in the human skeleton. Before we do this though, I'm going to set you a task straight away. This is task 1.1 on the website, and you can find this on our online learning platform just below the video. So if you click on that link, it should take you to a task where you're asked to match up the bones to the right part of the body. Pause the video now, come back in a few minutes, and then we'll go through this together. Okay, regardless of your score, let's go through some of the bones together, and of course it doesn't hurt to revise some of the bones in preparation for your exam. So let's see how we did. So the first bone there, we've got the cranium. Now we have to refer to the bones by their Latin name. Now we can't, for example, call this the skull. We have to refer to it for Level 2 and Level 3 by their Latin names. The jaw, which is also known as the mandible. The collarbone, which many people refer to it as, has to be referred to as the clavicle when it comes to your Level 2 and Level 3 examination. Your shoulder blade, of course there are many functions for your shoulder blade, especially pertaining to the gym-based environment, for example scapular depression, retraction, protraction. We'll talk a little bit more about that, but the shoulder blade is referred to as the scapula, and that's how you must remember it. The ribs, no fancy name for the ribs. Of course, the ribs are tasked with protecting the vital organs. Again, we'll talk a little bit about that as the slides go on. The humerus, which is the long bone in the upper arm. Many people, when they bang their elbow or their arm, refer to banging their funny bone, and this is the reason why. The vertebrae, of course, this is our spine. This extends from the base of the skull all the way down to the pelvis. We'll talk in great detail about the vertebrae on the next slide. The pelvis, as you can see, is quite a large flat bone. The reason for this is that it provides extensive room for muscle attachment. There's a lot of movement that takes place at the hips, and the pelvis allows the muscles to do that by providing a place for them to attach to. The radius, so we have two bones in the forearm. Now the radius radiates to the thumb, so whenever we're looking at a diagram, whichever one is connected to the thumb, that's going to be the radius. And the ulna, if you hold your hand out in front of you or your arm out in front of you, the ulna is always underneath. So ulna underneath. That's just one way that you could potentially remember that. Carpals, which are your wrist bones, the metacarpals, which provide the bones in your hand, and then your phalanges, which are your fingers. The femur is the longest and strongest bone in the body. It takes almost a ton of force to actually break your femur, so if anybody you know or yourself has broken your femur, then that's obviously a very serious injury. The patella actually resides within a tendon, and this is known as a sesamoid bone. We're going to refer to the different types of bones, and the sesamoid is one of them. Now, just like the arm, as you can see, we have the humerus, which then divides into the lower portion of the arm, which are then two bones, and it's exactly the same in the leg. We have the femur, which then for the lower limb divides into two. So the fin fibula, again, this is just one way that I remember this, the fin fibula. A lot of people refer to the fibula as the fibia. Of course, this is wrong. And the tibia, the tubby tibia. So the tubby tibia is the fatter of the two, and the fin fibula is the thinner of the two. And again, just like the hand, it follows the same process where we have the tarsals, which are the ankle bones, the metatarsals, which are the bones in our foot, and then the phalanges, which are our toes. The vertebral column is split into 5 different sections. Altogether, the vertebrae is made up of 33 individual vertebrae. The first section, which actually connects to the base of the skull and contains 2 individual vertebrae known as the atlas and the axis, this actually allows your skull to rotate. So the first one is cervical vertebrae, and this contains 7 individual vertebrae. So if you have a upper back injury and you've injured your spine, then you may have heard it being referred to as C4 or C5 or C6. So this is what is actually being referred to in medical jargon. Thoracic vertebrae, this is actually the largest part of the spine and contains 12 individual vertebrae. Here we're talking about a lot of rotation around the torso, so having a nice free thoracic spine allows you to do that. The lumbar vertebrae contains 5 individual vertebrae. This is where most lower back injuries occur within the lumbar spine. So if you are dealing with a client in the future that does have lower back issues, then it's likely that the lumbar spine needs to be manipulated in some kind of way. A lot of people, for example, sitting at their desk all day, do suffer with lumbar vertebrae injury. The sacral or sacrum vertebrae is actually 5 individual vertebrae, but they are different to the rest of the spine because they are fused together. Okay, so in this section here, as you can see, the vertebrae are not individual like you can see in the lumbar spine with the space in between, but these are in fact actually fused. And the same goes for the base of the spine, which you may have heard of before. It's known as the coccyx, and this is 4 individual vertebrae, which again are fused together to make up your tailbone. So, just to consolidate everything that we've done so far, again, a little task that you can do in the work booklet. It looks a little bit like that, so you can find that in the work booklet under task 1, major bones. Everything that we've done in terms of naming the different bones and naming the different parts of the spine and the individual vertebrae that exist within those particular parts of the spine, that's maybe something that you can go ahead and you can do now. So I'll give you a couple of minutes to do that, pause the video, come back, and then we'll carry on. Now, when it comes to the spine, you may be working with clients in the future where they have certain disproportionate postures of the spine, and of course it always helps to be able to try and remedy that, especially when it comes to some of the gym-based exercises to alleviate some of the conditions that you see before you. So let's just go through some of the different curvatures of the spine and try and link this to why these might occur and how you also may be able to treat this. So as you can see at the far left, we have a normal S-shaped bend in the spine. Okay, the person is stood up nice and erect. There is natural curvature of the thoracic spine and natural curvature of the lumbar spine. The second one is what's known as hyperlordosis. So you'll see here that the lumbar spine, which if you remember from the previous slide is the lower part of the vertebrae, is bent and curved more towards the front side of the body. Okay, so this creates a real arch in the lower back, and this can put a strain on your lower back muscles and indeed some of your abdominal muscles. Now, the reason for hyperlordosis may be down to people's habits in terms of sitting at a desk all day or sat down too often, and therefore their hip flexors become really tight, and then their lower back can start to hurt. So one of the ways in which to remedy hyperlordosis would actually be to start working and stretching the hip flexors. It doesn't even necessarily have to be stretching of the hip flexors, we can actually just roll them. So it could be that they need to be released in terms of what's known as myofascial release. So this is basically foam rolling, where can we release the hip flexors, and this will also alleviate some pain in the lower back. Of course, there are many other reasons as to why this could occur, but this is certainly not exhaustive. Hyperkyphosis, as you can see here, okay, is unnatural curvature of the thoracic and cervical spine. So we'll get almost that humpback look in an individual. So really what we need to be doing here is a lot of scapular work, scapular retraction, like face pulls, banded pull aparts, basically just to try and strengthen up those muscles around the scapula, open up the chest as well, which on the pec minor, which is here, and we'll talk about when we do the muscular system. Releasing that as well can also release some tension in the upper back and therefore relieve kyphosis. And then scoliosis, which is more often than not a genetic condition, is the curvature of the spine, as you can see, from left to right. So most people with scoliosis have a predisposition for it. It's not necessarily caused from any kind of posture or lifestyle issue, although it can be. This generally, in terms of your remit as a personal trainer, should be referred to someone as like I say, as a specialist who knows a little bit more about scoliosis in that area. The skeleton is split into two different sections, the axial and appendicular skeleton. So the appendicular skeleton has a specific job, a specific role within the body. First off, it contains 126 bones, and as you can see from the picture here, highlighted in pink, the appendicular skeleton, which includes the arms, the legs, the pelvis, the scapula, and also the clavicle. This is all about movement, so all of our movement takes place, of course, at the limbs, and we're able to take part in physical activity, of course, within the gym, because of the appendicular skeleton. So in terms of the appendicular skeleton's role and function, it's movement, and there are 126 bones that consist of the appendicular skeleton. The axial skeleton is more to do with protection. So as you can see here, we've got bones like the cranium, the mandible, and the ribs, and of course the vertebrae. These protect things like the vertebral column, the vital organs, heart, lungs, liver, etc. And then of course the cranium, which protects the brain. So in total there are 80 bones which make up the axial skeleton, which of course added together means that the human skeleton is made up of 206 bones. So when it comes to the anatomy of a long bone, there are a few structures that you need to be aware of at level 2 and level 3 anatomy and physiology. So let's start with some of the basic ones first. This is of course a long bone, so for example this could be the femur or the humerus. On the end of the bones we have articular cartilage. Now you may have heard of this before, so this is like a water-filled cushion which resides on the end of the bone to stop friction and also to absorb force. If there's any kind of impact that's put through the bone, the cartilage can actually absorb that. We also need to identify the different parts of the long bone. So as you can see here, we have the middle part of the bone, or the shaft of the bone, which is known as the diaphysis, and we have the ends of the bone here, which is known as the epiphysis. Now within the epiphysis we have what's known as spongy bone, and spongy bone, much like articular cartilage, acts as a shock absorber for any compressive forces which go through the long bone. So for example, physical activity, resistance training, of course, elicit forces which are going to go through the bone, and it's the spongy bone and the articular cartilage which will absorb that. Bone marrow, which you may have heard of before, we have two different types. The first type is red bone marrow, and red bone marrow is where all of our red blood cells are produced. So billions of red blood cells are produced every single minute, and it's within the red bone marrow of a long bone where this all takes place. Interestingly, the red blood cells, once they've finished their lifespan of about 2 to 3 months, they will then return back to the bone marrow where it actually was produced. So that whole process continually taking place. Yellow bone marrow is where we store two different things. We can store fat within the yellow bone marrow, and of course we can use that for all of the different types of roles and functions that fat plays within the body. But also we can store stem cells. Now stem cells are used to produce things like bone cells, cartilage cells, ligament cells. So whenever the body has a demand for any of those type of things, the yellow bone marrow can release that into the body and they can be used accordingly. Now of course, in order for that transport of nutrients to take place, we need an artery, and it's the nutrient artery which can embed all the way into the bone, into the depths of the bone, so that exchange of nutrients can go forward. And then lastly, we have what's known as the epiphyseal line. Now you may have heard of long bones containing what's known as a growth plate. Now growth plate is simply where the parts of the bone which actually elongate and grow as you age. So as we go through and mature into adulthood, it's the epiphyseal line which actually will grow and allow a human to get taller. So that's the growth plates which have got the ability to grow. That's down to the interaction with growth hormone and insulin growth factor 1, but that's beyond the scope of the level 2 and level 3 examination. So just know that the epiphyseal line is the growth plate and where growth can take place. Lastly, two particular cells that you need to be aware of when it comes to the skeletal system, and that's osteoblasts, which are cells which help to form new bone, and osteoclasts, which help to degrade bone and initiate any kind of remodeling. So osteoblasts are going to be activated, for example, for somebody that trains. Of course, there is a stimulus put on the bone, and of course we have to be able to adapt to that stimulus. So if it is resistance training, the bone will become denser, and therefore bone mass density will increase and the strength of the bone will increase, and it's osteoblasts which enable that to occur. Now osteoclasts are very important as well, because any cells which are damaged, they can be removed through these osteoclast cells. Of course, this is very important to make sure that we don't get any abnormal growth, and the osteoclast can keep everything nice and clean so that normal remodeling can take place. So this brings us to our next task now. In your work booklet there is a sheet which looks like this, and it's filling out the anatomy of the long bone. So based on the discussion we've just had, can you now label the different parts of the long bone, which of course will serve as good revision for your examination. So pause the video now, spend a couple of minutes filling out the worksheet, and then we'll continue with the slides. The skeletal system has many different functions. There are 5 which you need to be aware of for your examination. So we're going to go through these one by one now. The first one is supporting your body. So the skeleton of course provides our body with its shape and its structure and its stability, and without the skeleton of course we wouldn't be able to produce force, produce movement and things like this. So supporting of the body is a key function of the skeleton. Protecting your internal organs, I think this one is actually quite self-explanatory. We have the cranium, for example, which protects the brain, and we have the ribs, which protects the heart, the lungs and the vital organs around that area, and of course we have the spinal cord, which is protected by the vertebrae. Helping you move around. So Without the skeleton, of course, we wouldn't be able to move. Our muscles are attached to bone, and it's muscles which pull on bone which enable movement to occur and for us to be able to do the extensive range of movements that the human body can produce. Producing blood cells. So we mentioned the red bone marrow, which helps to produce red blood cells. Of course, with that, there are 4 different parts of blood. So we have the platelets, we have the red blood cells, and we have the white blood cells. So it's all within the marrow of the bone, long bones particularly, where these blood cells are produced. Storing energy and minerals. Now, bone is made up of calcium and phosphorus, so when your body, for example, might be running low on calcium, the storage that you have in your skeleton can actually be released into the bloodstream, and your body can take up any calcium there may be a deficiency of. So once again, just to consolidate that period of learning, can we now go to the work booklet, and can we fill in the function of the skeleton? There are 5 pictures there which give clues for the 5 functions that we've just been through. Can you just add a brief description to each one of those functions? Again, pause the video for a couple of minutes, complete the task, and then we'll continue with the slides. And the final criterion that relates to the first part of the skeletal system is all about the different types of bones that we have. Now, the first type of bone we've actually already been through. This is long bones. So long bones, of course, we find these in limbs. As we've mentioned, they have a diaphysis and an epiphysis. Remember, this is related to whereabouts on the bone that section of that area is. An example of a long bone, of course, the longest and strongest bone in the body is the femur. Of course, we have the humerus, the radius, the ulna, the fibula, the tibia. These are all examples of long bones, and you need to be aware of these. You may be able to identify an example of each of the different types of major bones. Of course, if there are long bones, then we also have short bones. So short bones, as the name mentions, are shorter than the long bones, light, strong, cube-shaped, and examples of these are the wrist, which are the carpals, as we mentioned in the very first slide, and the ankle, which of course are the tarsals. Flat bones, again we mentioned this very briefly when I spoke of the pelvis being providing an extensive area for muscle attachment, and this is really the main function of flat bones. They're thin, they're flat, and they're slightly curved, and of course these have large surface areas so that many different types of muscles can attach, and generally where we have a flat bone we get a lot of movement in the body. So of course at the pelvis, in the scapula, which are recognized examples of flat bones, we get lots and lots of different types of movement simply because the amount of muscles that are able to attach to those flat bones and the movement that we get at each. Irregular bones. Now, they are simply called irregular bones because they have a complex shape which doesn't really fit into any other type of bone labeling. So examples here might be the vertebrae or the facial bones. The cranium is actually made up of a whole host of bones which are actually glued together, if you like, by a substance called fibrocartilage. So irregular bones simply just have an irregular shape. Example which you may want to remember and is easy to remember are the vertebrae. And then sesamoid, we did mention this in the first slide. We mentioned that the patella, which of course is the kneecap, exists within a tendon, and this is what a sesamoid bone is related to. It relates to a bone which is situated inside a tendon. So the example for a sesamoid bone is the patella. Okay. So just to bring together everything that we've done so far, including the types of major bone, and as well you can see here there is an additional task from the axial and appendicular skeleton. There is a final task sheet that relates to part 1 of the skeletal system. So if you can fill in these tasks, pause the video, and once again we can start with part 2, which relates to joints, when you return. Well done on completing part 1 of the skeletal system. As you can see, now we're going to move on to part 2, which relates to the joints. This is a particular area of interest for personal trainers. and a good knowledge of the different joints and the movements that occur at those joints will set a really good foundation for you to be able to help clients as you move forward in your career. The reason for this is because many different clients, of course, will have many different problems, and this might relate to movement patterns that they are eliciting in the gym, and it also may be related to previous injuries that they've had. But a good, solid understanding of the joints will allow you to be able to put in place relevant interventions and remedies which can help benefit your client. So as we progress through this section, just keep that at the forefront of your mind, that there are certain takeaway points that you may be able to straight away implement into your practice in order to help your clients, of course based on the different types of issues that they may have. So let's get straight into it in terms of the different types of joints. As you can see here on the left hand side, we have 3 different types of joints. The first one is what's known as a fixed or immovable joint. Now, as the name suggests, of course we don't get any movement at this joint, but where 2 bones articulate, this means where 2 bones join together, this of course makes a joint. So from the first picture you can see here, the cranium, which we've identified as protecting the brain and we've identified as an axial skeleton, has actually many different individual bones which make up the cranium. Okay. Now, we don't get any movement here, of course, because that would expose the brain. Of course, we don't want that, because the main aim of the cranium is to protect the brain. So these individual plates, if you like, are joined together by what's known as fibrocartilage. So fibrocartilage is a superglue which essentially holds all of those cranial plates together. And that's what's known as a fixed or immovable joint. The second type is what's known as a cartilaginous or slightly movable joint. Now, of course, we only get slight movement here, little movement from side to side, and the best example of the cartilaginous joint is the vertebrae. Now, the vertebrae, all 33, which stack on top of each other, as we mentioned earlier, in between those individual vertebrae, we have what's known again as this fibrocartilage. Okay. Now, the fibrocartilage acts as a shock absorber for any force that goes through the spine, but also it inhibits any excessive movement through the individual vertebrae. Now, of course, the main aim of the vertebrae is to protect your spinal cord. So if these individual vertebrae were able to move extensively, then of course that could mean that we would sever the spinal cord, which could lead to paralysis. Of course, we don't want that. So it's the cartilaginous, slightly movable joints which contain this fibrocartilage where only slight movement can occur. So that slight movement we get at the individual vertebrae. But of course, when we think about the spine as a whole, as an entity, all 33 vertebrae that work together, of course we get great ranges of motion. So when we're talking about cartilaginous, slightly movable joints, and we give the example of the vertebrae, just keep in mind here that we're talking about the individual vertebrae and not the spine as a whole. And then lastly, where we're probably going to be spending most of our time learning, and that's the synovial joints. Now in total we have 6 synovial joints, and there are specific structures within a synovial joint which make it exactly that. So we're going to go through those structures in the next slide, but for now what you need to understand is that there are 3 different types of joints and there are examples for each one. So when it comes to synovial joints, there are specific parts of the anatomy, specific structures which make up a synovial joint. So if we look at this picture here on the right hand side and we imagine that this is the knee, so the knee is a synovial joint, we can see here that it contains 4 individual parts of the anatomy which make it a synovial joint. So the first one is cartilage. Now cartilage we've mentioned before, and cartilage we find on the end of the bones where bones articulate, and this does 2 things. Firstly, it stops those bones rubbing together, so it reduces any friction that may cause between 2 bones articulating, and it also acts as a water-filled cushion and which shock absorbs any forces which goes through those bones. So for example, when we jump up and down, we have nearly 10 times our body weight going through those structures. So the cartilage is particularly important to make sure that any of that shock doesn't wear on the joints and is absorbed through the cartilage. The second one is synovial fluid. Now, synovial fluid is released into this joint cavity. So cavity is simply just a hole. So you can see here that this hole between the joint is filled up with synovial fluid when we begin to warm up. So synovial fluid is actually secreted by the synovial membrane, which you can see here in green, okay? And whenever we start to do any kind of warm-up activity, synovial fluid will flood into that joint cavity, and again, much like cartilage, will reduce any friction and lubricate that joint. So this might be one of the reasons that when you do begin to warm up, you get a greater range of motion at particular joints. And then lastly, we have ligaments. So ligament you may have heard of before. They do a job in joining bone to bone. This is different from a tendon. A tendon attaches muscle to bone, but a ligament is all about adding stability to the joint. So in this example, if this was the knee, okay, then we have the ligament that joins from the femur and attaches to the tibia, and it keeps that joint nice and stable. So you can see as well here that we have 6 different types of synovial joint, and we're going to go through these now. But those 6 types, as you can see, are the hinge joint, ball and socket, pivot, condyloid, saddle, and gliding. So what you need to be able to do for your examination is identify an example of each one of these types of synovial joints, the movements which occur at each. So that's what we're going to be getting on with next. The first synovial joint that we're going to focus on is the ball and socket joint. So as the name suggests, this is where the ball of one bone fits into the socket of another. We can see here that this is an example of a ball and socket joint, which is at the hip, and we have the ball of the femur which fits into the socket of the pelvis. And because of its shape, the ball and socket joint is actually where we get most movement out of all of the synovial joints. Of course, we can get flexion, extension, hyperextension, abduction, adduction, rotation, circumduction. The movements are endless. So when we think about the hip and the shoulder, which are the 2 examples of ball and socket joints, of course, this is where we're able to get most movement. Now, of course, with most movement, this is also where we get most injury prevalence. Now, because of the vast amount of movement that we can achieve at these joints, it does lend itself to more injury susceptibility. But in terms of the 2 examples that you need to know, it's the shoulder and the hip. The second synovial joint that we're going to focus on is the hinge joint, and the hinge joint, much like the hinges on a door, allows movement in one direction, backwards and forwards. But in anatomical terms, this is flexion and extension. So if we take the example of the elbow, which is an example of a hinge joint, here you can see the ulna, which actually forms the elbow, and it connects to the humerus. And when these 2 bones join, this allows us to flex our elbow and to extend our elbow. So if we imagine a gym exercise, holding a dumbbell in our hand and then performing a dumbbell curl where we flex our hands up towards our shoulder, is a hinge joint movement. The same if we were flexing our knee, okay, so we would move our ankle up towards our gluteus maximus, our buttocks, and again this would be flexion of the knee, and this is all using a hinge joint where we flex and extend that joint. The next joint that we'll focus on is the pivot joint, and this allows movement through one single axis. So let's take the 2 examples that we have in the human body, and that's at the neck and also at the radio-ulnar joint. So first off, let's talk about the neck. Now, we did mention before when we were talking about the vertebrae that the top 2 vertebrae, C1 and C2, which are part of the cervical spine, the names for these are the atlas and the axes, okay? So if we imagine here in this picture that we have the vertebrae, which is running all the way through up to the base of the skull, and these 2 individual vertebrae, which are the atlas and the axes, these have the ability for transverse movement. So basically they are able to rotate, okay? So rotation across one single axis basically allows us to move our neck from left to right, Okay, so this is where we get rotation and the ability to spin our skull on a swivel. Of course, we're only subject to around 180 degrees worth of rotation, but it is the atlas and axes that allow that to occur. Now, the second example is the radio-ulnar joint. Now, this is where the radius joins the ulnar just underneath the elbow. So we've just been talking about the hinge joint, and the hinge joint allows movement in one direction, which is flexion and extension. But just underneath that, of course, you may notice that you're able to rotate your forearm. And being able to rotate your forearm has nothing to do with your elbow. It's a joint which sits below the hinge joint where the radius meets the ulnar. So you can see here in this picture, alright, we have the ulnar and the radius which are joined together here, and this allows you to rotate your hand backwards and forwards. Now, these have two very specific names. This is known as supination and pronation, but we'll talk about these specific movements as we move on to the movement section of the skeletal system. But for now, what you need to take away from this is that there are two examples of a pivot joint. We have the neck and the radio-ulnar joint. The fourth synovial joint is what's known as a condyloid joint. This is also known as an ellipsoid joint, depending on the textbook that you're reading, but for the purposes of our examination, we will refer to it as a condyloid joint. Now, this is just simply a modified version of the ball and socket joint, so we do get quite a bit of movement at this joint, however not near as much as the ball and socket joint, because we have the depression of one bone which fits into the oval surface of another. So here the examples are going to be the carpals, as you can see here. Alright, so we've got the carpals, but not in between the individual carpals. This is where the carpals meets the radius. So you can see here the radius has that oval shape, the depression of one, and the oval shape of the carpal fits into that depression. And this allows quite a bit of movement from forwards, backwards, side to side, so we can flex, we can extend, we can slightly rotate the wrist, and this is the purpose of a condyloid joint. So when you're asked an example, I want you to think about the wrist and also the ankle, because these are the two outstanding examples of a condyloid joint. The penultimate synovial joint that we're going to look at is what's known as a gliding joint. And a gliding joint, as the name suggests, is where two articulating bones which have flat surfaces will glide over one another and allow movement in all directions, so forwards, backwards and side to side. But because this is restricted by either ligament or fibrocartilage, we can't actually categorize those movements as flexion, extension, abduction, and so on. So we only get small restricted movements forwards, backwards, side to side. If you remember when we were talking about the vertebrae, we were talking about the individual vertebrae and how their movement is restricted. And this is so because of the fibrocartilage, which basically ensures that you don't sever your spinal cord. So really this is just a fail-safe to make sure that the gliding joint, yes, it can move, but it is very restricted in terms of what it can do. The other examples of a gliding joint are both the carpals and the tarsals. So we take here the tarsals, for example. You can see here we have a few individual bones, they have flat surfaces, and we do get some minor movement in the ankle and in the wrist. Okay, but again, not enough that we can actually classify it when we're talking about the movement between the individual carpals and tarsals. And last but not least, the final synovial joint is what's known as a saddle joint. So here again, we are restricted to the movement and we can't actually categorize it as flexion, extension and so on. We get small movements backwards, forwards and side to side. And the one example of a saddle joint within the body is actually at the thumb. The reason why it's called a saddle joint, as you can see from the picture here, we have essentially what is a saddle shape where two bones fit nicely into one another. So at the thumb we get, of course, the opposability of the thumb where we can move it independently of the rest of the hand, and it's the saddle joint which actually allows that to occur. So when you're talking about a saddle joint within your exam, make sure that we mention the example of the thumb. Just before we move on to the final section of the skeletal system, which relates to movements, I would like us now to consolidate everything that we've done so far regarding the joints and all of the synovial joints. So if we flick our work booklets to the final pages, you should see something which looks like this, and there are two tasks that I'd like you to complete. The first one is just relating to the three main types of joints that we find in the body. If you can just identify a brief description of what each joint does and maybe an example that we find in the body, then that of course will act as a nice refresher. And then here we can see that we can identify all of the different synovial joints that we've been through, the 6 that we've just been through, and then if you can identify an example of that joint within the body. The last part, which is the range of movement, we can fill in once we've completed the movement section, which we're about to do. Before we do that though, pause the video, complete those two tasks, and then we'll continue with the video. And the last part of the lecture today relates to human movement. Now, the human body is capable of a huge range of movements, and essentially how movement occurs is a muscle which overlaps a joint will be innervated, pulls on a particular bone, and then allows movement within that particular joint. Now, being able to identify a joint and the movement that occurs, and therefore the muscle which is innervating that movement, you may be able to identify movement dysfunctions or causes of injury with clients that you may work with. So we're going to look at the broad range of movements, look at the joints which are involved, and then I'm going to ask you at the very end to bring all that together and identify the movements that can occur across the 6 synovial joints that we've identified. Flexion and extension are the first two which we will be focusing on. Very simply, flexion is bending a limb which decreases the angle of the joint, and extension is straightening a limb which increases the angle of the joint. So if we take, for example, the elbow joint, which we referred to before as a hinge joint, when we do a bicep curl and we are contracting the bicep, so that is moving the barbell upwards towards your chest, we are experiencing here flexion of the elbow because the angle between the wrist and the bicep has decreased, and therefore this is flexion. This would be the same during a hamstring curl. If we were bringing the ankle up towards the hamstring, we are decreasing the angle between the ankle and the hamstring, and therefore this would be flexion. Extension, you can see from this picture here that when we lower the weight during the bicep curl, we are increasing the angle, and therefore this is known as extension. We get many different examples of flexion and extension throughout the body, but when it comes to providing the easiest example, we always refer to a bicep curl or a leg curl. These are simply going to be the easiest to remember because this occurs at a hinge joint where we can increase or decrease the angle very easily. We've also got hyperextension. Now, hyperextension is where we move beyond the normal position of the joint. So, for example, if we take the neck, okay, and we were to bring the chin down towards the chest, okay, then what we would get here is flexion because we've decreased the angle. And then if we were to bring the chin up to the position we can see in the picture, this would be extension. And then hyperextension would be then lifting the chin up even further and tilting the head further back, and we would get hyperextension here at the back of the neck. Okay? So hyperextension is movement beyond the normal position of the joint. So as we mentioned, flexion and extension isn't just about the hinge joint. We get this across many different joints in the body. So basically here's just another example for you to learn from, and this is flexion and extension of the spine. As we said, the vertebrae as a whole, all 33 of them, can move with quite a bit of range of motion. It's individually the vertebrae are not allowed to move as much. We mentioned that earlier, but you can see here that the cyclist is flexing his vertebrae, and therefore this is decreasing the angle between the hips and the shoulder, and therefore because we're decreasing the angle, we know this as flexion. And you can see here that the spine is extended, okay, the angle between, again, the hips, the chest, the shoulder has increased, and therefore is known as extension. Okay, so this is really just to show you that we have this flexion and extension increasing and decreasing the angle of the joint throughout many different parts of the body. If we were to identify where we see this in the gym environment, of course, this flexion of the spine could be an abdominal curl, and then extension, of course, could be the relaxing or the eccentric phase of an abdominal curl. The next two movements that we're going to look at are abduction and adduction. So very simply, when we talk about abduction, we are moving a limb away from the midline of the body. So in anatomical terms, we have a imaginary line which goes down right between the middle of the body. It splits the left and right sides, and when we move a limb away from that midline, we are abducting it away from that midline, so therefore it is known as abduction. Adduction is when we are moving the limb back towards the midline, so we are adding it back to our body, and this is known as adduction. We can also see from the groin abductor here, the leg abductor machine, that as the knees move away from the midline of the body, that we are abducting the femur. Again, this is taking place at the ball and socket joint of the hip, and again, this is just another example of abduction occurring. Rotation is turning a limb, or even again your torso, through a vertical axis. So the hip, the spine and the shoulder are major players in any kind of rotary movement that the human body can produce. And when we talk about rotation, we're talking about mainly producing power. The body produces torque and produces power mainly through the transverse plane, which we will talk about at the end of this lecture, the different planes of movement. But whenever we want to produce power, and that is striking a golf ball, as you can see in the picture here, throwing a ball, throwing a punch, striking a football, we have to produce some rotary power through the hip, through the spine, or through the shoulder in order for that transfer of power from one limb to the other. Okay, so rotation does occur in most sports, and whenever we want to produce any kind of power, it's rotation through that spine, through that hip and through that shoulder, through a vertical axis, that vertical axis being the majority of the time through the spine, and the hip and the shoulder being the main drivers in that torque production in order for you to produce power. So in terms of examples that we have in the body of rotation, we mentioned before about the atlas and axes of the neck, where we're able to move the head through 180 degrees. So the vertical axis being the vertebrae, and then of course the skull being able to rotate on that axis. Okay. When we talk about, let's say for example, the golf swing, we can see that the limbs, the arms, the shoulders, they are rotating through that vertical axis of the spine. So we have the thoracic spine here, which is rotating, and then that power build up that we get in the backswing is then transferred onto that front limb, through that front shoulder, and then of course through the ball in order to produce power. Circumduction refers to moving a limb through 360 degrees. We're only able to get this at two joints, and that's the shoulder joint and the hip joint. And the reason for that is because both of these are ball and socket joints. So the ball of the humerus fits into the socket of the scapula, and the ball of the femur fits into the socket of the pelvis. And it's because of the shape of the joint that the arm and the leg is able to move through 360 degrees. So we might see this movement in the gym, for example, just through some 360 degree warm up for the shoulder or for the hip. Of course, we can see this in the picture here, that the swimmer is able to get full range of motion during the front crawl, and therefore generate more power through that shoulder joint because of the ability to go through that 360 degree motion. So circumduction, moving a limb through 360 degrees. Pronation is actually a form of rotation. Now earlier when we spoke of rotation, we spoke about joints such as the neck, or we have the radial ulnar joint. Now radial ulnar joint, which exists just below the elbow and allows you to rotate your forearm. This is because where the radius meets the ulnar, which is a separate joint to the elbow, we're able to get this form of rotation. Now, it's at the forearm where we get this specific type of rotation, which we know as pronation. And as you can see from the description here, the definition, pronation is where the palm is facing downwards or facing forwards with your anterior body. So anterior body, of course, is the front of your body in anatomical terms, and when your palm is either facing down or facing forwards, we've got pronation. So you may hear in gym lingo referring to a pronated grip, and this is a form of pronated grip. You can see that the forearms, okay, or the underside of the forearms are facing forwards, or the palms of the hands are facing forwards, and we have an overhand grip which is pronated during this latissimus pull down exercise. Okay, so it's important to remember that pronation is just a form of rotation. This refers to the radial ulnar joint, and it is where the palm is either facing down or it is facing forwards when we have this overhand grip. And then we have the opposite to pronation, which is supination. Now, we've got a supinated grip and we've also got a pronated grip in gym lingo. And what this is referring to when we talk about supination is simply the opposite of pronation. So this is now where the forearm or the palms are facing towards your body and rather than away from your body. So you can see here that when we do, for example, a pull-up or a latissimus pull-down exercise, we have a pronated grip here because the palms are facing away from the body. But when the palms are facing towards the body, this is referred to as a supinated grip. So we may take a supinated grip, for example, during a chin-up, where we have the palms facing the body, and then we try to work the bicep brachii. One easy way to remember supination when the palms are facing up is imagine holding your bowl of soup. So when we're holding a bowl of soup, we're in a supinated grip, and therefore this is referred to as supination. Just one maybe silly way that may help you to remember supination during your examination. And the penultimate movement that you need to be aware of when it comes to your level 2 and level 3 examinations is dorsiflexion. Now, dorsiflexion we experience during any kind of running, jogging, even walking exercise, and this is simply just referring to when the toe is pointing up towards the sky. Okay, what we're doing here is we are innervating the tibialis anterior, which is a muscle on the front of the shin. That then, of course, pulls on those bones in the foot, and that's when we get that dorsiflexion, which of course allows us to complete the motion of walking or running. Plantar flexion is the opposite of dorsiflexion, so this is now where the toes are pointing downwards towards the floor. One silly way that you may want to use to remember is that you are planting your toes into the floor, and this of course is allowing us to innervate our calf muscle, which is the gastrocnemius, and of course this as well helps to innervate the full posterior chain, which you can see during this runner's action, especially on her trailing leg. So plantar flexion is simply pointing the toes downwards or planting them into the floor. And then lastly, once we've gone through all of the movements, we have now the movements which occur in 3 planes of motion. Now, if we imagine a sheet of glass which separates different parts of the body, we can get this movement across 3 different ranges or 3 different planes of motion. And as you can see, those 3 different planes of motion are the transverse plane, the frontal plane, and the sagittal plane. So let's go through each one individually and then identify some gym movements where we could get movement across these planes. So the first one is the transverse, and again, if we imagine a sheet of glass going through the midsection of the body, which separates the upper half and the lower half, we get all transverse movement which occurs in this transverse plane being rotary. Okay, so any rotation that occurs through the hip, through the shoulders, and of course through the spine is occurring through that transverse plane. So when we talk about examples of movements that we see through the transverse plane, here we're talking about oblique rotations. So for example, there is a resistance machine where you're just simply moving your upper torso with an added resistance of a weight from the machine, and we're moving the body here through that transverse plane. Okay, of course we're rotating and we're getting some oblique innervation. Medicine ball rotations, so as we are in a sit-up position and we twist the body from side to side, again we're getting that rotation of the spine, rotation of the shoulder, rotation of the hip through those med ball rotations, which again is related to the transverse plane. And then T press up, so as we do a press up and then we rotate the body and we end up on one hand and we rotate the body all the way through, again we are getting motion here through the transverse plane. When it comes to the frontal plane of motion, this separates the front and the back of the body. Okay, so when we're getting movement that is basically side to side through abduction and adduction, we are moving through the frontal plane of motion. So frontal planes of motion movement, we see for example here the lateral raise. So as we bring a dumbbell and we abduct the shoulder, we are moving that dumbbell and our arm through the frontal plane of motion. A lateral lunge, okay, so as we step out sideways in a lunge position, once again we're moving in the frontal plane, which is again abducting and adducting those limbs. And of course we have side bends, so moving my torso and bending my oblique as I move my arm towards the lower part of my leg. Again, I am moving in that frontal plane and I'm getting some innervation again in the external oblique. Sagittal, now this is where most gym movements actually occur. They occur through the sagittal plane, and this is where we get movement which is in a straight line. So basically we're talking here about flexion and extension. As you can see, again, if we imagine that that plane of glass going through the body, we are separating now the left and the right sides. So any movement we get going forwards or backwards, we're referring to movement in the sagittal plane. So here we're talking about bicep curls. If we were to move a dumbbell and flex the elbow up towards our chest, then we are moving that dumbbell and our arm through the sagittal plane of motion. The same for lunges. Again, we are moving forwards and backwards as we go through that movement. Running, again, we are flexing and extending the knee. We are flexing and extending the elbow during the running motion. Again, this is occurring through the sagittal plane. And again, squatting, deadlifting, we are getting flexion and extension of the hip joint. So again, this is movement which is occurring through the sagittal plane. Well done, that's the skeletal system completed. All of the level 2 and level 3 criteria has been covered in this video. So now you're ready to take your practice assessment, which of course will prepare you for your final assessment on anatomy and physiology. So just click on the link below. It should generate the quiz and take the 10 questions that we prepared for you. Good luck.